And I want to welcome everybody who's joining us from all over Upper Manhattan and a few of you from beyond for this conversation with Dr. Graig Spencer, who is on the front lines for us. He is in emergency rooms here in the New York Presbyterian system, day in and day out, putting himself at risk and saving lives for us. And we're grateful for his service. You might know him also. He rose to prominence in New York City and beyond in 2014 as a volunteer who went to Africa to serve in the Ebola outbreak and himself contracted the virus. Came back to New York and thankfully was able to heal. And as everyone remembers, the virus did not spread here. He lives right here in our community, right in the heart of West Harlem, and he's been serving in the ER here uptown for a decade. Before I pass it over to Dr. Spencer, I think we're also joined on the line, if we're not yet, we will be shortly, by our Congressmember Adriano Espaillat. Congressmember, are you with us?
Yes, I am. Do you hear me?
Wonderful. I can hear you. I'm not seeing you at the moment, but I'll ask you to offer us some words of introduction if you'd like. Please, sir. There you go. We see you.
Okay. Very good. Thank you, Mark and Dr. Spencer. Thank you for being here with us. These are difficult times and uncharted waters, but I'm sure that with the experience of Dr. Spencer and with the leadership of our council member who chairs the health committee in the city council, and all of us working together, we will overcome this pandemic, and we will be stronger towards the future. Hopefully, we'll hear some good pointers, some good tips from the doctor, and both Mark and I will be here ready to ask or answer any questions. Thank you so much, Mark, for having this.
Thank you, Congressmember, for everything you're doing to fight for us in Washington and here in the community uptown. It really means a lot. And I realized that I didn't introduce myself. So in case you didn't figure out, I am Mark Levine, council member in the 7th District, which covers parts of Washington Heights, West Harlem, and the Upper West Side. And I also chair the health committee in the New York City Council. We're going to make this as bilingual as we can, so I'm just going to offer a very quick word or two in Spanish. Bueno, quiero darle una fuerte bienvenida a todos los televidentes y quiero que sepan si quieren hacer sus preguntas en español, siéntese bienvenidos, se le va a traducir y contestar en español. Ustedes son parte de esta conversación. With that, I'd like to turn it over to Dr. Spencer. And perhaps, Dr. Spencer, you can address something that's, I think, on the minds of everybody. What are you experiencing in the emergency rooms now? What has it been like in recent weeks during this pandemic? And can you answer the question that's on everybody's mind? Is it a little less worse than it was before? Please, Dr. Spencer.
Thanks. Yeah, thanks for having me. Thanks for putting this together. As Mark mentioned, I've lived in this community for nearly a decade, which I know in New York, I'm from Detroit initially. I know in New York doesn't make me a New Yorker, but I feel like I'm here and installed in Harlem. And I love this community. I love where I work. I love the people that live in my building and the people I meet on the street. It's really important to me to be part of this community. So I'm happy to go on CNN, but I'm happier to be here talking to everyone. As Mark mentioned, I've been working at New York Presbyterian, Columbia University Medical Center at 168th, as well as the Allen Hospital further north, just on the tip of Manhattan up in Inwood for nearly a decade. I've worked thousands of shifts in the emergency room. I've met maybe many people listening to this call or many people, many of your family members and taking care of them. What we're seeing right now obviously is very different than our normal. You know, generally we see a lot of chest pain patients, patients with abdominal pain, dizziness, weakness, a lot of things. And unfortunately and strangely, we're not seeing those patients so much right now. We're seeing a lot of coronavirus patients or COVID. COVID is how we'll talk about the disease itself, people that are infected with coronavirus. And many of these patients are presenting with the symptoms that we've heard so much about: breathing difficulties, shortness of breath, low oxygen, fever. And this, in the past couple of weeks, has really taken over in our clinics, our hospitals, our emergency rooms, and our intensive care units. So that now the overwhelming majority of people that I see on a daily basis and my colleagues are seeing are all coronavirus patients. What that has done is it's really forced us, and I know everyone is hearing the sirens. If you're here in the community as well, the sirens have been nonstop. What we're seeing now, it's really forcing our teams to be flexible and adapt. Hospital leadership has had to think about how we recreate and redevelop the ERs, how we redeploy other providers, doctors that are dermatologists or urologists, maybe don't really ever work in the emergency room, but right now it's an all hands on deck scenario. So our leadership and our emergency department and all the people working here in nursing, infection prevention and control, environmental services, every single person on the front line in our hospital has been thinking about how we redevelop to fight this disease, because quite frankly, it's overtaken everything that we've done. And we've seen, unfortunately, a lot of the impact, a lot of the consequences. It's brought a lot of despair and unfortunately a lot of death to our community. And it's something that we're still thinking every single day, how do we improve? I appreciate the Congressman as well as Mark and everyone else's work in the city to advocate for us, both at the state level with Governor Cuomo, who I think is doing a great job at the city level, but also at the federal level, where there needs to be a lot more to get us the things that we need to have the best response here. And I'll just end quickly with addressing that last question. Are we in a better spot today than we were yesterday? It seems like it. Looking at the data, we're hoping that we've reached that apex. We've reached that highest number of cases per day, deaths per day, people being put on life support or ventilators per day. I'd still want to see more trends over more time. So over the next 5 days, 7 days, couple weeks, to be certain that that's the case, because many of you may remember that not this past weekend, but the weekend before, we had a dip in deaths. Everyone thought that that was when it was starting to go down. But in reality, we had just the highest number of deaths the day after. So we think things will seesaw, things will go up and down. We're still seeing a lot of people in the emergency room. People are still being put on life support. We are still losing New Yorkers every single day to this disease. But we hope that we're starting to get a little bit to the other side of this.
Well, we hope you're right. And again, we thank you for what you're doing for us every day in difficult conditions. We want to get as many questions from all of you who are joining us for this Q&A, and you can message us through the Zoom app, and we'll be getting to as many of your questions as we can. We have the doctor until 7 p.m. So I'm gonna get right into the first question, but also Congressmember Espaillat, if you at some point want to jump in with a question or a comment, by all means, please do. But I do have a question here from Andres Orejuela, who says, the number of infections and the rate of mortality is higher among people of color. Is there anything we can do to change that?
This is a really important observation. This is so important. I know that, Mark, you were calling for this recently, and we got this data a couple days ago showing that the impact on communities of color and people of color, Latino, Hispanics, Blacks, African Americans, and others all throughout New York is not the same as it is, quite frankly, for whites or for Asian New Yorkers. We know this because even before coronavirus came, there were already structural or health inequities, meaning that some communities were not receiving, weren't able to receive the same access to care, didn't have the same level of insurance, and maybe didn't have the same access to primary care. This is a huge issue that needs to be fixed outside of this pandemic, but also within it. We're seeing that so many people, in the outer boroughs, in Staten Island, in the Bronx, in Queens, in Brooklyn, this is where the virus has tackled and has really had the greatest impact, because I think that's where the majority of New Yorkers live that don't have the same ability, the same financial ability to socially distance, to stay at home. We know that so many people are continuing to go to work, doing the essential things that we need all over New York City. And quite frankly, many of them happen to be from already marginalized communities in the city. We're seeing that in terms of the number of infections and the death rate. So the most important thing, I think, first is showing that this is an issue. Many of us in the emergency department knew we're seeing this, but it was only once we finally got that data that we could prove that this was impacting some New Yorkers more than others that we were able to really start advocating and talking about this issue.
Yes, and I want to mention something that the Congress member and I have been fighting for. In the next phase of this epidemic, the only hope we have to return to normal is mass testing and contact tracing for people who may have been exposed, and finally, real quarantining for people who aren't sick enough to be in the hospital but still need to be protected from exposing their family and others.
Yeah.
And we want to make sure that it's communities of color like Washington Heights, West Harlem, and Inwood, which are first in line to get those resources and facilities as we enter the next stage of the epidemic. We have looked at the zip code by zip code breakdown of the number of cases of coronavirus. And in Manhattan, the two worst zip codes are 10032, which is Southern Washington Heights, where I happen to live and partially represent, and 10040, which is the heart of Washington Heights. Those are the two zip codes in Manhattan. And you see this pattern repeated all over the city. And we want to make sure that our resources reflect that we're serving the people who are in greatest peril. I don't know, Congressmember, if you wanted to add anything to that.
Sure, yes, Mark. As the doctor well put, this virus, this pandemic has amassed to everyone what many of us knew for decades, the health disparities that are plaguing this city and the nation. And when we see the map, we see the numbers, and for example, you see the West Bronx area, the area of Highbridge and Kingsbridge getting hammered really. And that's an area where many folks from the Heights have moved to in the last 2 decades. And then you see the 2 zip codes that Mark highlighted, 140 and 132, also with very high numbers. And of course, then you see what's happening in Queens and in Staten Island, in certain areas of Staten Island. And it just draws our attention to this glaring and pronounced disparity amongst New Yorkers, which is, and the other factor, Mark, is that my district, the 13th Congressional District, is geographically the smallest district in the country. And so we're literally living on top of each other. Many families, 5 and 6, 7 members in a 1-2 bedroom apartment. And what happens is when someone is test positive and they don't have any symptoms, or they have very light symptoms, they go back to those apartments and then infect their family members. And so this is a real problem. I'm sure the doctor perhaps could talk about that. If the doctor could highlight the fact that many folks that are not in serious conditions at the hospital or in a ventilator, those folks that are having light symptoms go back and infect their family members. Even if they take the precautions that are necessary, it's almost impossible for that not to happen. So if the doctor could highlight a little bit more about that, that would be helpful to all of us.
I'd be happy to, Congressman. Yeah, this is what the EMS has been telling me for weeks. They'll go into an apartment where 5 or 6 or 7 people are living, and it's nearly impossible if one person gets sick for the rest of the family, the other people living there, not to get sick. It has been noted that we have not been admitting to the hospital everyone with coronavirus. Thankfully, it's because we don't necessarily need to. We're trying to focus on the moderately and the sickest patients. We're admitting everyone that needs to be admitted. There are some people that are getting sent home with a little shortness of breath, with fever, still with symptoms. But what we're trying to do is we're trying to focus on the sickest, because each patient requires a lot of work. Can be 6 to 8 providers for 1 hour. And we've already been pretty limited on the front lines in terms of not hospital beds initially, but the number of providers. So people have been going home. Now, the problem is as the Congressman points out, is that means that many are going home to situations where they may infect others. This is being looked at now. Right now, Columbia is opening up. I think as of today, Bakersfield, which is that arena with a bubble right next to the Allen Hospital in the north end of Inwood, the goal being that hopefully we can have a place for hundreds of patients who may not be necessarily sick enough to be in the severe part of the hospital, but can't safely go home where they may infect others. So there has been action on this. Again, we need a lot more, and we're doing everything that we can. We have plans for how we're going to adapt that, but this has hit us so hard and so quickly that we still need some time to implement and adapt. Yeah, it's taking a toll, but we're doing everything we can to prevent it.
So in addition to what the council members said, the massive testing, we will be pushing for these buffer zones, these shelters, if you may, where people will be able to spend 2 weeks a while before going back to their homes. I think this is so important to prevent this from moving the way it was moving forward, and we're optimistic that we'll get that done. There is a testing site in the Bronx and Lehman College, right across Lehman College. We're pushing to get, the city just opened just yesterday another testing site, our Harlem Hospital, and where both the council member and myself are working to get one up and started right here in Washington Heights. So testing is really important, and of course not going back home to infect your families, and if you do have to go back home, taking all the measures necessary to prevent that from happening, I think is critical.
Dr. Spencer, we've gotten several people who've asked a version of the same question. One was Andrea Soccorso and one was Robin Greenstein, which is, can you clarify whether it's safe to go out for things like solo exercise? Because there are a lot of people out who are on the trails and parks and jogging and walking and bicycling. And is there a medical recommendation on whether that's advised?
Thanks for those questions, Andrea and Robin. I go out for a run. It's one of the best ways for me to decompress. I also spend the overwhelming majority of the time that I'm not working in the house. Staying home does not mean you need to stay home 100% of the time. We need people to stay home to save lives. People still have to go out. Many are essential workers and need to go out. Some need to go to the grocery store. And quite frankly, many of us need to get out of the house, even if it's for a walk or a run. I think that that's okay. Make sure that you're wearing a mask or some type of face covering whenever you go out all of the time. That'll help prevent the spread of the virus to others if you're sick. And you could still be sick even if you don't have symptoms. And it will also hopefully help a bit to prevent you from getting infected, although it's less helpful for that. In any event, I think it's good to go outside. Just make sure you're wearing some type of covering and maintain that 6 feet of distance at all times from all people. I know that what happens is you'll see your friends out on the street. You haven't seen them in a while. The first thing that people do is they go up to their friends and they take off their face covering or their mask to talk to them because we want to get back to some type of normalcy. It's hard for us to remember that's not where we are right now. So my recommendation is, yes, it's okay to go out, wear a mask, stay 6 feet from others, try to go out at times when there are fewer people outside, so early morning or late in the evening, but we need to balance the social distancing with our need for physical exercise. So I'm going out, I'm going for a run. Sometimes I'm taking my kid out every once in a while to get out of the house, but we just need to do it responsibly.
Great. I have a question. It actually came in Spanish, so I'm going to read it in Spanish, and then maybe we'll just do a brief translation after you answer, Doctor. It's from Marina Delgado. Dice, me preocupa viajar en el ascensor de mi edificio. ¿Cuánto tiempo vive el virus en espacios reducidos y en superficies como el metal? So she's asking about her concern. Marina's asking about traveling in the elevator of her building and asking how much time does the virus live in compact spaces and on surfaces like metal?
Okay, that's a really important question. Let me just emphasize that the majority of transmission is going to happen through respiratory transmission, the overwhelming majority. So your likelihood of getting the virus from touching a doorknob or from touching something else like a package or food delivery is relatively low. So focus again on the respiratory stuff, making sure you're wearing a face covering. This is why we don't want people going out to spread that virus. It's not a bad idea to be cautious and thoughtful when you go out. So try not to touch a doorknob or take a rag or take a wipe or something if you can. Use your elbow. I use my elbow to touch the elevator buttons. Think about, if you're opening the doors or opening anything with your hands, to try to sanitize before you touch your face. Sanitize or wash your hands as much as you can. I would worry less about the transmission of the virus on fixed surfaces than I would about respiratory transmission, although it's good. And I know it's boring and everyone hates hearing it, but washing your hands is so important. It helps prevent not only transmission of coronavirus, but many other viruses and bacteria. So anytime you touch anything, it's definitely before you touch your face. It's hard to not touch your face, I know. Make sure you're washing your hands regularly throughout the day, and that'll dramatically decrease your transmission.
Excellent. Brevemente en español, Marina, el doctor dijo que la mayoría de los casos son a través de los pulmones, se respira el virus. El riesgo es mucho menos cuando se trata de tocar una superficie y lavándose las manos a cada rato, tiene que ser por 20 segundos. Es manera de protegerse de tocar superficies tales como botones en su ascensor. Kristen Giles has asked a question. Actually, it was a multi-part question, all of which I can't get to. But there were two parts that I think are, 2 points that I think are worth getting at. One is on the question of relapses and whether someone who's already had the virus is actually immune. And there's a second unrelated question, which is whether the virus, it has to do with what Marina just asked, can be transmitted through the ventilation systems of your building. So those are unrelated, but if you could touch on both of them.
Sure, and I'll try to answer them quickly so we can get to all the questions.
Sorry, doctor, she does point out that there have been patients allegedly in Korea who have gotten the virus after they believed that they had healed.
So this is a really important question. We think that once you have the virus, once you are infected and once you survive, when you recover, you have antibodies, and those antibodies will prevent you from being reinfected. That is true in the overwhelming majority of cases. We don't know how long those antibodies will protect you, at least a couple months, maybe even longer. We don't know. Now, the reports you're hearing in South Korea and other places about people having been sick, testing positive, then testing negative, and then testing positive again, we don't know. My suspicion is that it's probably more a problem with the test than with the actual result of the test. So no test itself is 100% perfect, and the way that we're using the tests are not 100% perfect, because you have to get a swab and you have to put it all the way back in your nose, really, really deep. And sometimes that doesn't happen. People can't handle it, or the person doing it isn't doing it correctly. And so a test may be falsely negative when it's actually positive. I think the likelihood that people are positive, then become negative, then get reinfected is extremely low. It may be true for a very small subset of people who had a mild infection that didn't build up a lot of antibodies or otherwise have a low immune system. But again, the overwhelming majority, almost all cases, if you're infected and you recover, you will have antibodies that will prevent you from reinfection for some period. And again, that period we don't quite know yet. There was a second part of that question.
Well, it was unrelated about the risk of contracting the virus through a ventilation system in your building.
Again, this is another thing that's been brought up. I would suspect that the risk of this is also extremely low. It's possible. I'm sure that someone will come out with some anecdotal case report saying it's happening. But again, this is not the overwhelming majority of cases. It's probably not many cases, if any at all. I would focus on the big things. Again, this is why it's important to continue washing your hands if it's on surfaces, and just taking precautions, normal precautions in your house and when you go out. And that is gonna decrease your likelihood of being infection the most.
Thank you. We've had a question from Susan Dess and one or two other people about food that you're bringing into your home. And that there are questions about whether if you buy fresh produce, how you should handle that to make sure it's not contaminated. Is a rinse in the water enough? And then there's a question about delivered food, which is hot food, and therefore obviously you can't rinse the hot food. So any thoughts about the level of risk and precautions for food you're bringing into your home?
Absolutely. I think the guidance that I give, and this is what I'm doing at home here, any fresh produce I am washing. I wash all my produce all the time, because we've all been in the C-Town, we've all been in the Key Food, we've all seen people handling the red peppers. I wash it all the time just to prevent any infection. I think that's enough here to, if there's virus on this, to get rid of that virus and to keep you safe, especially if this stuff is food that you're gonna cook. Some people are taking things and then putting them in the fridge for a few days before they use them, or keeping them quarantined in bags for a day or two before they use them. Whatever you do that makes you feel the most comfortable, I think, is fine. But if you're washing your fresh produce and running it more than just, a second or two, but running it for, 10, 15 seconds under the water, I think that that's okay. In terms of delivery, I know that this is a really important question for a couple of reasons. One, a lot of people either can't or don't feel comfortable going outside. So we're ordering a lot more delivery. And two, we all want to support the restaurants and the restaurant owners and workers we know and love in our communities. So it is important to continue to support those that are still able to stay open while they're still being safe. I order delivery. What I do when things come is I try to maintain distance from the delivery person, who again, they will be the heroes of this outbreak. They're working harder than most of us. We try to either do contactless delivery so they can drop things off at the door, or make sure we're both wearing masks. And then if things are in bags, I'll take them out of bags and I'll take them and I'll just wipe them down. I have some Lysol wipes, I'll wipe things down. But again, I think that I'm probably still being a little overcautious. We know that the transmission from this virus is almost all the time is going to be respiratory, and your risk from delivery or from produce is extremely low.
We got a question that just popped up from Ren, and I missed the last name, but it's also one that we often hear about masks. And it's a concern that it's very hard to get a surgical mask, much more so an N95 mask.
Yeah.
So what should the average member of the public do? How should they protect themselves when they're out in public?
It's a really good question. I've been trying to give some guidance on this to friends that also didn't know on social media, on Twitter. Masks is hard. So what the official guidance is, we've been saying that people should wear a face covering. It doesn't have to be a surgical mask or an N95 mask. We say face covering. That can be anything. It can be a bandana that's been folded over itself a couple times. Anything that gives you a little bit of protection. Again, what the mask or the face covering is doing, it's not as much protecting you from others as protecting others from you. We know that a good percentage of people who have this disease are asymptomatic, meaning they feel perfectly fine, but can still spread it. So you wearing a mask when you go outside is extremely important. We are in New York City, where the transmission of this virus is higher than any other place in the world. Your risk is high just by walking outside. Let's decrease that by everyone wearing a face covering. Now, do you need a surgical mask? No. If you have them, can you use them? Absolutely. Just be thoughtful about how you use them. I see a lot of people with wearing them with the nose showing or under their chin. Obviously, if you're wearing it under your chin, it's not covering your mouth or your nose, it's not working at all, but we see that a lot. Don't take it off when you're talking to people. Use the loops. Do not grab the mask by itself. Every time you touch your mask, it gets dirty and you risk infecting yourself because you're touching near your eyes. Around the N95 masks, you see those are the thicker masks that look like those painter masks. Do you need an N95 mask? No. If you have them, can you wear them? Sure. The one thing that I caution people is that every single year in my hospital, all of us are required to do a training. I've done this so many times. It's because N95s require a specific use. You have to put them on correctly and you have to take them off correctly to prevent yourself from being infected. So again, a mask or a face covering does not in itself protect you. It's how you use them that protects you. And a lot of citizens, as well as my colleagues in the emergency departments, don't use them correctly. I think the New York Times and some other outlets have done a really good job of explaining how to use masks. I'm sure there's some things on YouTube as well, some videos about how to use them correctly. Just make sure the most important thing is that when you're going outside, you're having something covering your face, whatever it is, whether it's a folded bandana, an N95, or a surgical mask.
Thank you. I have a question from Edgar Santana. I was sick but couldn't get a test. Why is it so hard to get a test in New York City?
That's a great question, Edgar. We could talk about this for a really long time and talk about the kind of the structural architecture of pandemic preparedness in the United States and how it's let us down. There's been issues with testing for quite some time. There was a decision to not use a test that was developed by the WHO that was being used in other places. We tried creating tests, but we lacked the right reagents, and there was some missteps at the CDC. We were slow to get started with tests. We're ramping up our capacity, but there are problems with them. One, you need providers to do the tests. Providers need to be in personal protective equipment. We've had personal protective equipment, things like gowns and masks and gloves. For a while, we've had shortage of those things, so that healthcare workers themselves, some did not have the amount of personal protective equipment that they needed. So it was being primarily focused on healthcare workers. The other thing is that such simple things like swabs, nasal swabs that are necessary to do the test, are in very short supply. Many hospitals have stopped doing things like flu tests or other viral tests to see if you could have a virus, because swabs are really limited. And so there's a couple things. It's not just tests, it's the things to do the tests that are short. And also it just requires a lot of work and a lot of capacity to build these up. Now in hospitals, if you show up to an emergency room, for example, and you are sick with coronavirus, I have a lot of patients that are frustrated because they have fever, cough, maybe some shortness of breath, maybe their oxygen has dropped a little bit. They want a coronavirus test. And almost invariably, almost always, if you're not being admitted to the hospital, you will not be given a coronavirus test. That is because we are treating it as if you have symptoms consistent with coronavirus, you have coronavirus. And we tell people to isolate and act as if they have the illness. I know it's really frustrating. Ideally, we would be testing everyone so that we can tell them for sure. But right now, the capacity just doesn't exist. And I recognize that's frustrating for a lot of people.
Excellent. I got a question from Lori Boris, which is, do you have enough masks at your hospital? And if not, can people donate homemade masks?
That's really sweet. Thank you, Lori. Just like how this virus is in kind of unequally impacting populations throughout the city, it's also having a different impact on different hospitals or different healthcare systems. I'm lucky enough to work at one of the biggest healthcare systems in the country. We have a lot of supplies, we have masks. I've never had to worry about my masks. I've never had to worry about my personal protective equipment. But I have friends that work at other hospitals throughout the city who do not have the same luxury. I know that things have, in many places, substantially improved over the past couple of weeks. And hopefully if case numbers continue to go down, there won't be the same pressure on the number of masks. There have been a lot of people who have reached out to hospitals to say, hey, we'd like to make you masks. We've had people make us masks or 3D print us face shields, which we've actually been using in the emergency department that have been really wonderful. I think as of right now, the concern that we were going to run completely out of masks has dropped. There has been a big increase in production. Again, it's variable at different hospitals throughout the city. What I'm hearing, more importantly, is that other places throughout the country actually are dealing with a lot of the issues that we were dealing with a couple of weeks ago. So providers only given one N95 a week or one surgical mask a day. What we need to recognize is that once this pandemic starts to tail off in New York City, it will still continue to roll throughout the country. And this is an instance in which we need to think not about just New York City or New York State or just our region, the impact this is going to have all throughout the US and how we're going to be able to help respond everywhere with the lessons we've learned.
Thank you. Reed Perron and a couple of other people asked about the question of whether you're contagious while you're asymptomatic. Mm-hmm. And Reed put the question in the form of, I'm asymptomatic, I've had no contact with anybody who's COVID positive. So, why do I need to worry about social distancing?
Reed, that's a great question. And the reason is that it's the asymptomatic or the mildly symptomatic people who can go about their normal life, who can continue to go outside, to drink with their friends, to do all these other things that all of us want to do. Those are the people that are probably more likely to be spreading the disease than those really, really sick people who are breathing hard and are not getting up from their bed. We know that a lot of people who have coronavirus don't necessarily have symptoms or may not have bad symptoms. We know that one of the most common symptoms is a loss of taste or loss of smell. So even if you feel fine, it's really important to assume and understand that you may be sick with coronavirus. Think about that with all of your interactions. Think about it, whether you would go and visit your grandma and give her a hug, or to other populations that have a higher likelihood of getting this illness and having negative consequences of it. I've been telling people it's smart to assume, unless you're already recovered or unless you, for some reason, know that you're not sick, you had a negative test within the past couple of days, to assume that you could have coronavirus and act as if you're potentially positive, because you could be, and we just don't know. We're finding so many more people are asymptomatic and have this disease and just don't know it and are passing it along in our communities.
Okay. I have a question, actually, it's from someone who preferred to remain anonymous, but they say, I hear few people are surviving once they are put on a ventilator. And in so many words, they're asking, does this indicate a shortcoming in the ventilator as a method for helping people?
What we're finding out is that this disease is unlike anything any of us have seen before. And again, I've worked in Ebola, I've worked in the middle of trauma, in civil war, but coronavirus is just really weird in the way it presents, what it does to the body, and we just don't know enough. We have been putting a lot of patients on ventilators, and we're starting to see some of them come off. A lot of the people we've been putting on ventilators have been young and and old and all different kind of age groups, all different colors, all different backgrounds. But the majority of them are older with medical conditions. And quite frankly, the majority of them do not come off the ventilator. We don't know whether this is a failure of the ventilator, whether we should be putting fewer people on ventilators, or whether we should be doing something different. We're learning so much more about this disease every single day. And the amount that I know today versus a week ago is staggering. We're required to read a bunch. We're talking a bunch. I have 10 different WhatsApp groups with ER doctors all over the city and all over the country, trying to keep us all updated. The sad reality is that there's still a lot we don't know. We're doing what we would normally do for these patients. So a patient with a low oxygen, breathing hard, or having a hard time breathing, we'll put on a ventilator because that's quite frankly one of the only things that we can do right now. Unfortunately, it is not 100% life-saving 100% of the time.
We have a question from Jane LeBeau. She asked, I had symptoms in January that are similar to what we understand coronavirus is now. Is it possible that I had the virus and didn't know it?
It's a good question. Thanks, Jane. We know that coronavirus was here at least in February, by late February, maybe a little bit earlier. Potentially there was some cases around here even earlier than that. We don't exactly know. Jane, if you've traveled other places, for example, to the West Coast, Seattle, or internationally, it's also possible that you picked up the disease there. Another really important thing to remember, though, is that a lot of people think maybe I've already had this disease and I can go out living my normal life as if I have antibodies. In January, there's a lot of other reasons to have respiratory illnesses, other coronaviruses, in fact. The one we're dealing with right now is a novel coronavirus, meaning that it's new. I see coronaviruses every single year. They're just different than this. We see flu, we see other illnesses. So I would assume that given that it was January, you did not have the coronavirus. I would assume that I would not assume that you have antibodies and you can go out and act as if you have already had it. The problem is that we just don't know. What we're hoping to ramp up soon is this antibody testing. So the ability to actually look to see if in your blood you have those antibodies that can help fight off this infection. This is something that's going to be rolling out a lot more over the next couple of weeks, will be a lot more available, and will hopefully be part of this plan to get us back to work, get us back to some sense slowly of some normalcy.
And if I may, there's a promising trial underway of donations of blood plasma from
Correct.
those of us who have recovered to those people who are still battling coronavirus. And there's a very exciting trial, I think at least in Mount Sinai Hospital. I don't know if it's happening in New York Presbyterian yet, but also today, the New York Blood Bank put out a call for donors. So if you, amongst those who are participating in this conversation, have yourself recovered from coronavirus, you have a chance to help those who are still battling by donating your blood plasma. And actually, we just put out on our Twitter account the link if you want to sign up. But I don't know, doctor, if you want to comment on the promise of that treatment and how much a part of the solution this will ultimately be.
It's a good point. Look, right now, the only thing that we know that actually decreases cases and decreases mortality or death from coronavirus is staying home. That's it. There's a bunch of other things, hydroxychloroquine, azithromycin, maybe blood plasma, maybe remdesivir, maybe a bunch of other trial medicines, but we don't have the data yet to prove their efficacy, to prove that they actually work. We hope that all of them work. We hope, because we would love to have something else, but we don't know. Around plasma, this has worked for other similar viruses, but quite frankly, we don't know. When I was treated with Ebola in 2014 here at Bellevue Hospital, I got plasma treatment from an Ebola survivor with the idea that it was going to work. It didn't work. It gave me some complications. And we've also tried scaling it up internationally in other resource limited contexts. It takes a lot of work. We haven't seen the data actually support it. So I want to be happy about this. I want to be enthusiastic and say this is going to be the magic bullet. But right now we don't know. That being said, if it is going to work, we need people to donate blood, and we should have them start donating now so that we're not trying to catch up. We're actually prepared. And on top of that, we need blood. Where there's a shortage of blood all throughout the city. We need blood. So if you're able to donate blood in a way that you're able, to safely do so, please consider doing that.
Thank you. We have a question from Norma Campusano, who's actually a prominent district leader here in the community. I believe she represents you, Doctor, so I have to introduce you, but she actually asked her question in Spanish. She says, tenemos personas mayores que tienen mucho pánico y no quieren salir de su apartamento y viven solo. ¿Cómo podemos apoyar? We have people who are extremely scared, who are senior citizens, who live home alone and don't want to go out. What advice can we offer them?
It's a great question. I have a couple of people just like that in my building. One of my neighbors has been in this building for over 50 years. And early on, we all went down and said, hey, we want to support you. If you need groceries, please let us know. Made sure that she had a mask, made sure that she was able to get her rent paid without having to go to the bank to pull out money. I think we just need to come together as communities, in our families, in our buildings, in our neighborhood, to think about the people that we can support. We want to prevent those that may be older and more susceptible, or those with underlying low immune systems from whatever reason. We're going to prevent them from going outside as much as possible, because that's when their greatest risk is. It means we can come together. We can think about how to do that in our apartment buildings, putting together some drives, having people who are able to go out. I know that on Nextdoor and a couple other community websites, they have set up some of these social support groups. I think that they exist. It's something that if you look up, you can link to. But think about your family, think about your friends, and think about the people in your building that you might be able to help, and lend a hand. Give them a call. I check in with a couple of my neighbors every day or every other day. They give me a call if they're not feeling okay. We talk about whether I should go see them or whether they should go to the hospital. Just something that we can all do. Just provide that base level of support for people around you, and hopefully that's enough.
Thank you. We got a question from Craig Schreier, who says he has a daughter about the age of yours, Dr. Spencer, and he wonders about the kind of precautions that you would need to take for a child that age. I think you said your daughter's about 17 months.
Yeah.
And the fact that you're coming in and out of the house, is that something you need to take precautions against? And I'm presuming that she gets to leave the house sometimes. You have to take precautions in those cases. And then he's asking on a more human level, how is it on the family that you are away for such long shifts in the ER? So that may be a little bit too personal, but to the extent you're comfortable answering, please take it away.
Absolutely. Yeah, so what I do when I go to work, when I leave work, I change into different clothes. I walk home, which is really nice, which allows me to decompress. When I get home, I make sure to not touch any knobs, clean everything, and then take off my clothes, the majority of my clothes, in the hallway. My neighbors know what I do, so they're okay with it. And that way I put everything into a bag, and then I kind of quarantine that bag in a different part of our apartment until I'm able to wash it. We're just really thoughtful and responsible. I immediately walk in and take a shower. I don't let my daughter, or my wife helps prevent my daughter from coming up and touching me, although she really wants to. She hasn't seen me all day. In terms of the impact that it has on my family, it's tough. We're two working professionals. I have a job outside of working in the emergency room. I teach at Columbia. I'm on the board of directors for Doctors Without Borders. And all of this is a lot of extra work. We're not sending our child to daycare anymore because I'm at a high risk of being infected and didn't want to share that risk with other kids and other people in that daycare. I have a wife who's working a full-time job. It's tough for anyone that's working at home right now with a spouse or with a friend or with family. You recognize how difficult and trying this is. We try to connect with family just like this on Zoom calls. We try to find other ways to give each other space, but I'm sure that my household is like many of yours, and that there's daily challenges of keeping a kid happy, especially one that's recently learned the word and value of outside. Yeah, it's a struggle. Just know that we're all kind of dealing, you know, people working in the emergency room are still dealing with the exact same things that so many of you are dealing with on a daily basis, in addition to really having the pleasure and the honor to go into work and take care of our community members.
Dr. Spencer, this is a perfect illustration of why those of you in frontline medical care right now are heroes. The lengths that you're going through to protect your family are extraordinary. I'm sorry you have to do that, but my goodness, thank you from the bottom of my heart. I am certain that every single person listening feels the same way in hearing you talk about what you're going to protect your family.
I appreciate it. I think everyone that I work with feels like this is our duty and this is our responsibility, and we're happy to do it. I've actually never seen my colleagues work so well together. I've never seen us face adversity in such a similar way and come on the other side of it. It's tough. The physical exhaustion is hard. Being in goggles and masks all day is tough. The mental exhaustion of it, it's really unlike anything that we've planned for. Many of my colleagues didn't sign up for this, quite honestly. They didn't think that this is what they were going to be doing, but everyone shows up for it every single day. So it's really a lot easier when we have an awesome, dedicated crew of people that are happy and honored to do this on a daily basis, despite how tough it can be.
Well, I'm not sure if you can see the comments coming in through Zoom, but there are a lot of expressions of thanks and gratitude coming in right now.
Absolutely.
We have gotten many questions about elevators because we live in Washington Heights and West Harlem, and all of us live in elevator buildings.
If we're lucky to be in an elevator building, exactly, yeah.
Right, well, maybe this might be a time where being in a 5-floor walk-up is an advantage. But when you talked about this being spread as a respiratory disease, I think people are worried. Then, my goodness, I'm in a small elevator, and the elevators in Uptown Manhattan are small, as you know. Do I have to worry about just being in the same space as someone is breathing, or is it really more about being coughed or sneezed on?
Yeah. So if you're in an elevator with someone else, you're probably within 6 feet. Think about that. So we still say that 6 feet distance is important. What I've been doing is I live on the 5th floor in an elevator building. I will, if someone's going up or down, I will wait and spend a couple more minutes waiting for the elevator. I won't get in. One, because I know I'm a much higher risk, but also just to kind of lead as an example. Do you need to be worried about someone who is just casually breathing? Not as much. We know that the majority of the transmission is via respiratory droplets, so people coughing, sneezing, etc. That doesn't mean that it doesn't happen, that they're not shedding some virus just during normal discussion. Again, we don't know exactly how much. We know the majority of it is from people that are coughing. That's the way this virus and many other viruses work. I would say, again, make sure that you're wearing some type of face covering, because if you are doing so, and you are not within 6 feet, whether on an elevator or in the park, the likelihood that you're going to transmit this virus to anyone else is extremely, extremely low, whether you're symptomatic or not.
Excellent. Doctor, we got a question from Gary Hardcastle and a couple of other people about a very hot topic, which you did touch upon already, which is hydroxychloroquine, and the extent to which that should already be given to patients broadly in our hospitals, and the extent to which, in your estimation, this will be a solution to help us get out of this crisis.
Hydroxychloroquine, for some reason, has gotten so much discussion with very, very little data. So this is the way that I think about this, and this is the way I talk about it. One, hydroxychloroquine is taking up so much of the discussion when we're not focusing on these issues like racial and structural inequities, these social determinants of health, things like poverty and your skin color, where you live. They have a much bigger impact on your ability to get this disease. Hydroxychloroquine itself, the scientific basis for using hydroxychloroquine is extremely, extremely limited. There is no evidence-based study that says giving hydroxychloroquine will have any significant impact on lowering mortality. Full stop. There was a study that came out of Brazil today showing that they ended it early because of complications related to the drug. It can have complications such as loss of vision or problems with your vision. It can change the electrical activity of your heart and cause heart problems. That happens to a very small subset of patients, that's correct. And other people have been taking hydroxychloroquine for things like lupus and rheumatoid arthritis for a long time. When we start giving this to a lot more people, if we gave it to millions and millions of people, we'd see a lot more complications from this disease, from this medication than potentially we would from the disease. Again, we don't know. Do we all hope hydroxychloroquine will be a magic bullet, will be a magic medication? Absolutely. Do we have any basis right now to be giving it either prophylactically or as any type of treatment with the expectation that it's going to save lives? No. Are a lot of places still giving it as part of a protocol? Yes. Do we know whether it's actually making a huge impact yet? No. That, I think, is the most important thing. A lot of people say, well, why not give it? There are side effects with all medications. And at this point, it's almost as if it's a coin flip. Yes, it may not help, but it may also hurt. So when we start thinking, if there's a medication that will save lives, I assure you that we will all be pushing. We will be pushing on the congressman. We will pushing on everyone to get us this medication, make sure that we have it. But as of right now, there is nothing, hydroxychloroquine, remdesivir, plasma, any other medicine that has been shown to reduce mortality in any way that has any rational evidence base that we normally use when we think about and when we base our treatment guidelines.
Thank you. We got a question from Vanessa Aronson, who also happens to be a prominent Democratic activist, just like Norma. She asked about pregnant, expectant mothers and the impacts and risks and precautions that pregnant women should take and possible impact on the fetus.
This has got to be such a hard time for for pregnant New Yorkers or those hoping to get pregnant or those even with a new baby. I'm thinking back on our experience of delivering on the Upper West Side and me being able to be there throughout that whole process. I can't imagine not having a partner or other people there with you. So my hearts go out to everyone that's going through that process right now. In terms of what impact does it have on someone who's pregnant or on the fetus, again, the data is still pretty limited. Initially, we thought that it didn't have much of an impact. Some people said that because in pregnancy or your immune system is already a little lowered naturally, that your body doesn't create this big inflammatory response. And that may actually be protective against having the worst complications of this disease. Right now, we don't know. We haven't seen a lot of pregnant patients infected with this, but that is actually increasing now. And some of my colleagues are talking about some complications they've seen. There have been babies born to mothers who were COVID positive, who ended up testing positive. There have been babies born to mothers who were COVID positive that ended up testing negative. Again, as of right now, we just don't know. We're basing a lot of this on other viruses that act similarly, but we just don't have enough data to say one way or the other. What I'm recommending is that pregnant patients try to do as much as they can to protect themselves as much, if not more, than everybody else, because again, we just don't know.
Okay, I want to remind folks that we only have about 5 minutes of Dr. Spencer's time left. And I want to, maybe Dr. Spencer, we can try and squeeze 2 or 3 more questions in real quickly. So Jeff Shaw has asked us about mass transit and the question of how someone who may be in a high-risk group can protect themselves on things like buses and subways.
Yeah, I know that I spoke to the MTA maybe last week and did a video for them highlighting that, you know, hopefully if you're on the trains, you're an essential worker. We want the majority of people to stay home who can't stay home. We also recognize, of course, that not every New Yorker can do that for economic reasons. If you have to get on the train and you want to protect yourself, I'd say go at off hours when it's less likely to be crowded. The MTA right now has had a lot of their staff who's called out, who is sick. They're running fewer trains. They're running fewer buses. They're also concerned about buses being crowded, not only for their workers, but for the community as well. Take the same precautions as you would otherwise. Try to ride a little earlier or a little later. Try not to go at hours or times when there's a lot of people on the bus or the train. Make sure you're wearing some type of face covering. If you can distance, obviously try to do that. Wash your hands after touching the poles or anything else. That's really all that you can do if you have to be on the train, if you have to be on buses. And I understand that many people have to continue to do that because otherwise they wouldn't be able to pay their rent and get food and do all those other things that we need to be doing even in the middle of a pandemic.
Thank you. I have a question which is very quick that I can answer about the plan that had been in the news to use St. John the Divine, a large cathedral in the southern part of our district, as overflow hospital space for what used to be called St. Luke's, but now it's known as Mount Sinai Morningside. Turns out that that plan has been suspended for a good reason. They don't think they need it at the moment. And I think that's one sign that we may be getting over the worst of this, with the caveat that Dr. Spencer always offers, which is that we have a long way to go and things are still very intense in our hospitals. But just a clarification on St. John the Divine. We had a question from Indiana Port to this, maybe the last one we have time for, a good friend and activist uptown, who Indiana asked about a friend whose employer has told them they need to take an antibody test, which is not FDA approved. And does that put the employee at risk in any way?
This is a really good question. We're going to be hearing so much about the issues around antibody tests. And again, those measure whether or not you've been exposed. That's a different type of testing. My understanding is that many of them coming on the market right now are not FDA approved. That was intentional so that we could get many of them out as quickly as possible. We're hoping that if you have a test that says you have antibodies, it proves you've been exposed and that you're unlikely to be reinfected. There's a couple problems with that. One is, I don't think, as of right now, and again, I'll leave this up to you gentlemen and others, what are the actual policy, the political policy around your employer being able to demand that you have some type of antibody testing? I think that's a big question. But two, even a positive or negative antibody test doesn't necessarily prove anything. We need to know how good those tests are, and if they're being made by private companies, we don't know exactly if all of them are going to be up to the same standard as one that was made by the CDC, so that's a big concern. Two, you can have antibodies, you can start building an antibody response while you are still sick. So you could still be spreading the disease, you could still be contagious, but you could already have some antibodies. There's a crossover between your symptoms, which can last for a week or two, and after a couple days, you might start building up some of those antibodies. So you can be both at once, and that's really important to remember. An antibody test most of the antibody tests are like a pregnancy test. They're a threshold. They're either positive or negative. They don't tell you how many antibodies. They don't tell you how immune you are. So I think there's a lot of questions around privacy and around kind of employment restrictions, things that we need to think about as a city, as a state, as a country, in terms of how we talk about antibodies and antibody testing for us going back to work. I will let the others much smarter than me work on that policy, but I will just warn that right now, just be cautious about antibody tests, especially private ones. We don't know how great they're going to be. They are not a get out of jail free card. They do not mean that you can walk outside if you have positive antibodies, because you could still be infectious for a period of time.
So, Dr. Spencer, I'm not sure if you or the folks on our Q&A can hear the background noise, but
we hear my opera singer outside.
Well,
yeah.
It's 7 o'clock.
7 o'clock.
What a perfect indication of the emotion that we're feeling right now. People on Fort Washington Avenue are yelling, singing, and banging pots and pans to thank you and all the healthcare workers who are sacrificing for us. You are heroes. We're going to wrap up in a second. I want to ask Congressmember Espaillat if you'd like to offer some closing words for us, please.
Sure. Thank you, Mark. Thank you, Dr. Spencer. This was a wonderful opportunity. I learned a lot from what you had to say. Every time I hear somebody with your experience, I learn even more. You are truly a hero. Just to think that you leave every morning and you put your life on the line out there to make sure that the rest of us are safe is a great testament to your courage, to your ability to help others. And so we want to thank you for everything you do. We'll ask you to come back again because you were so wonderful in this exercise. So I'm sure you have more information to give us and we'll all benefit from it. Thank you, Mark. Thank you for this effort.
Thank you, Congressmember. Dr. Spencer, the fact that you do 12-hour shifts and still take the time to share with our community this way means the world. Thank you from the bottom of my heart. I see a flood of texts and messages coming in from everyone who took part of this call. Muchísimas gracias, doctor, por todo, por su sacrificio. Usted es un héroe. Thank you very much. And thank you, Adriano, for being part of this conversation. I'll give you a last closing word, Dr. Spencer, and then we'll sign off.
I just want to thank everyone for putting this together, for tuning in. I know there are other things happening in your life, but I know people really want information right now. I'm happy to do this as much as we possibly can. Thank you to Mark. Thank you to the Congressman for pushing and advocating here for our city, both locally, regionally, and nationally. It's really important to have people behind our back. And I just want to point out as well that it's not just the healthcare people, the healthcare workers that are doing this, but it's people working in the grocery stores, it's people running the trains, it's everybody who's showing up every single day to make sure that we're all safe. So if you have the opportunity to thank your first responders or thank the people when you're checking out at the grocery store, do so, because it goes a long way and it means a lot. Thank you, everyone.
Amen to that. What a wonderful note to finish on. Thank you again to everybody. This is going to conclude our Q&A. Thanks to all of you, the hundreds of you who took part. And everyone, stay home and stay safe.
Thank you.
Good night.
Be well. Cuídate.